over the last month, particularly since the Senate bill failed in that dramatic midnight vote, I've worked with 4 governors closely, as well as with senators and members of the administration in a very quiet group that the governors included Governor Ducey of Arizona, Governor Bryant of Mississippi, Governor Walker of Wisconsin, and myself. And we have worked, as well as our healthcare teams, trying to formulate something that both expansion and non-expansion states can support. And the result of all of that is, with the leadership of Senator Cassidy and Senator Graham, it is the Graham Cassidy bill. And I see this bill as the best and last opportunity to repeal the Affordable Care Act, which is the wrong direction for America. And I also see this as covering the major points that I've advocated for during the last 6 months. And that is flexibility for the states. And this is very, very important. It does not represent a significant cost shift to the states that I've expressed concern about. I've not been bashful about that. I haven't been hesitant about it. I've called it the way I saw it when it represented too much of a shift to the states. I do not see the Graham Cassidy bill in that fashion. As long as there's coverage, that is the key thing that we're trying to accomplish. And so you've got to be careful as to how you measure the flexibility of the states. They say, well, you're going to eliminate so many people off of Medicaid. Well, if you look at the expansion states, we take all of the expansion dollars plus all the other money that flows through the Affordable Care Act for that expansion population. We take that money, we divide it up the states, and we tell the states that it's up to them to design their system. It might be part of a continuation of the Medicaid expansion. It might be some other design that they have to utilize the exchanges. And so it gives the states what they have been asking for. It allows us to continue Arkansas Works. The unique expansion that we had utilizing Medicaid dollars on the insurance market, it allows us to continue in that innovation. It allows us to continue with the reform that we've already tried to accomplish. And so it gives us a consistency in our approach to Arkansas, and our Arkansas families can have confidence that it's not going to be a huge amount of disruption. It will be a continuation of a program that I believe is successful, will continue to be successful, but allows us to fill in the dollars beyond in the event that there's unmet needs. Very importantly, under the Graham Cassidy bill, no state match is required. As you know, right now, we're at, 5% as a state match. This was $100 million, and when it goes up to 10%, it will be $200 million of general revenue per year to cover the expansion population. But under the new formulation, there's no state match required because it's all a black block grant. It's all one chunk of money, and you don't have those false firewalls in there. And so it frees up more than $1 billion in general revenue between 2020 and 2026. And that means that we can utilize that freed up revenue for, there are actually not any restrictions on it. It could go back to general revenue, it could go for other purposes of our state, but it also could be applied toward healthcare needs that we might identify. And so it really gives us the maximum amount of flexibility that we could imagine under this latest proposal. I don't know whether this will pass or not, but I do see it as the last best chance to repeal the Affordable Care Act. That's where I've been from the very beginning, and I see this as an opportunity to continue the care that we have innovated in Arkansas and want to be able to provide that increased access to care. We don't want to go backwards. We want to go forward on this, and I think this gives us the opportunity to do it, but to continue to innovate. There's already some stories out there that somehow this is going to cost Arkansas billions of dollars, hundreds of millions of dollars. It's just not so. If you look at the entire nation, the Graham Cassidy bill between now and 2026 will fund 95% of what is currently funded under the Affordable Care Act, 95%. So there's a 5% savings there, but that is shifted around in the states. When you look at it from Arkansas' standpoint, we look to these numbers carefully, our whole team, and I'm satisfied that there's not a retrenchment on the federal participation in the healthcare system in Arkansas, but there's a continued commitment. So where do the savings come from? They come from the fact that we've all got to tighten the belt. You look right now that we were sort of happy in Arkansas that our insurance premiums only increased 10%. 10%? That's a lot. And so while we are so much lower than the rest of the nation, we've got to do better than that. And part of that is in the overall cost control efforts that we have. But it's also about saving our individual state dollars and general revenue dollars that gives us an opportunity to do that. And again, it gives us the maximum flexibility, but the federal participation will continue. I think it's the right kind of partnership.